Good morning, ladies and gentlemen. Let me introduce myself. My name is Naila, and I'm responsible for the health managers. The purpose of my presentation today is to inform about ringworm. If you have any question you'd like to ask, please leave them until the end, when I'll be happy to answer them. In today's presentations, I'd like to cover 3 points. Firstly, what is a ringworm? Secondly, ringworm symptoms. And finally, causes of ringworm. To begin with what is ringworm? Ringworm is fungal infections that attack the skin, hair, or nails, characterized by a circular, itchy, and scaly rash. After knowing the definition, we have to know the general. Sorry, I'm repeating again. After knowing the definition, we have to know the general of informations. Now let's take a look at types of ringworm. First, ringworm of the scalp, Tinea capitis, characterized by the appearance of scales on the scalp that develop into itchy, scaly patches, most common in children. Second is ringworm of the body, Tinea corporis, often appears as patches or rashes with a distinctive shapes, namely like a round ring. And third is jock itch, Tinea cruris, refers to ringworm infections of the skin around the groin, inner thighs, and buttock. These conditions often occurs in men and adolescent boys. Fourth is athlete's foot, Tinea pedis. Another name is water fleas. It's a term for ringworm infections of the feet, often experienced by people who often go barefoot in public places, where the infections can spread, such as a locker room, showers, and swimming pools. Now we'll move on to how ringworm transmitted. First is like direct contact, touching an infected person or animal, or touching infected skin. Second, indirect contact, touching contaminated objects such as towels, clothing, combs, or footwear in locker rooms. Third is environment. The fungus can survive in warm, moist environment, for example, such as shower, swimming pools, or saunas. So that's an overview of what is a ringworm. As you are all know general informations about ringworm, so you should know about ringworm symptoms for to protect yourself. Ringworm symptoms. Symptoms of ringworm are characterized by a reddish, very itchy circular rash which can spread if not treated immediately. In addition, there are other symptoms such as itching. The rash is usually very itchy, which can cause sufferers to scratch and worsen the conditions. Scaly skin. The skin around the rash can become scaly, dry, and look like a peeling skin. Cracked. In some cases, the skin around the rash can crack or blister, especially if the fungal infection is not treated immediately. Blister or pus-filled wounds, severe case. If the fungal infection is not treated properly, blister or pus-filled wounds can occur around the rash. I'd now like to move on to symptoms vary based on the locations of infections. Some types of ringworm based on the area of the body infected. First, ringworm of the body skin, Tinea corporis. Symptoms: a ring-shaped rash with a red border and is more prominent. The center often looks lighter or scaly, itchy, and can spread to other areas of scratched. Location, arms, legs, or other areas of the body. Second is ringworm of the scalp, tinea capitis. Symptoms around bald area with scalp skin can cause hair loss in the affected area, sometimes accompanied by swelling, pus, or crust. Itchy and can be painful. Location scalp more common in children. Third is jock itch, tinea cruris. Symptoms red rash in the groin, inner thighs or buttock, itching and burning sensations. The edge of the rash may be darker and have clear borders. Location, the groin, thighs or buttocks. More common in men and people who sweat a lot. Fourth is jock itch, tinea pedis. Symptoms crack or peeling skin between the toes, severe itching, especially after removing shoes. Skin may become red and blistered. Location, the feet, especially between the toes. Next, the difference between ringworm and other skin disease like scabies, eczema, psoriasis. First, ringworm versus scabies, a fungal infection, while scabies is caused by a mite bite. Both ringworm and scabies cause itching, redness, and discomfort. Second, ringworm versus eczema. Ringworm is curable while eczema is a chronic condition. Ringworm can be treated with antifungal medications while eczema often requires long-term treatment. Third is ringworm versus psoriasis. Ringworm is characterized by a scaly circular rash while psoriasis is characterized by scaly patches of skin. Ringworm can affect the head, hands, feet, face, or even the groin. Psoriasis often affects the knees, elbows, trunk, and scalp. So much for about ringworm symptoms. I'd just like to give you some background information about ringworm, a common fungal infection that affects the skin, scalp, and nails. Ringworm is caused by a group of fungi called dermatophytes, not by a worm or parasite. These fungi feed on keratin, a protein found in the outer layer of skin, hair, and nails. Causes of ringworm dermatophyte fungal infections. There are three main types of dermatophyte fungi that causes ringworm. First is trichophyton, can infect the skin, hair, and nails. Second is microsporum, usually attacks the skin and hair, often transmitted from animals to humans. Third is epidermophyton, usually attacks the skin and nails but not the hair. Next, how ringworm is transmitted. Ringworm is highly contagious and can spread in several ways. First, from human to human, occurs through direct contact with the skin of an infected person, for example, through touching, hugging, or shaking hands. More common in environments with a lot of physical contact, such as school, orphanages, or sports venue. Risk factors: sharing clothes, towel, or personal items such as combs and hats. Second, from animals to humans, zoonosis. Pets such as cats, dogs, rabbits, cows, and horses can carry this fungus, especially kittens and puppies. It often occurs when someone touches the fur of uninfected animal, especially if there is a small wound on the skin. Sign in animals circular hair, loose, scaly skin, or itching. Third is from infected object, personal objects such as towels, combs, clothes, bed sheets, helmets, or sport equipment can be a medium for spreading the fungus. The fungus can survive on this object for days to weeks. Fourth, from infected soil. Some species of dermatophyte fungi can survive in the soil for months. Transmissions usually occurs if someone touches contaminated soil for a long time, especially if they have a wound on the skin. More common in farmers or people who often garden without gloves. Next, I'd like to take a look at complications if untreated. First is hyperpigmentations. Hyperpigmentations occurs when certain area of the skin become darker than other areas. Even though ringworm has been cured, some people can still find hyperpigmentations on the skins. Second is carrion. Carrion is a red lump filled with pus on the scalp. When experiencing these conditions, several lumps can appear at once on the scalps. In addition, in certain people, symptoms of lethargy and fever can appear along with locations of carrion. This complication also causes hair loss to the point of baldness in certain area. Third, cellulitis. Cellulitis is a bacterial infection that can occur if ringworm of the nails and feet is not treated. This disease is caused by the the entry of Streptococcus pyogenes and Staphylococcus aureus bacteria into the deep skin tissues. Symptoms of cellulitis are pain, burning sensation on the skin, red spots, and lumps. Fourth is Majochi granuloma. Majochi granuloma occurs when the fungus that causes a ringworm spread to the hair follicles and infects the deep layers of the skin. This complication triggers the appearance of hard, pink lumps filled with pus on the skin. Majochi granuloma can attack any part of the body that has hair, including the scalp, face, arms, and legs. Let's look now at treatment ringworm. Treatment for ringworm in humans generally involves the use of topical cream, ointment, or oral or tablet antifungal medication depending on the location and severity of the infections, as well as the recommendations to maintain cleanliness and avoid sharing personal items. Here is a more detailed explanations. First, types of antifungal medications: topical, cream, or ointment. Medications such as clotrimazole, metronidazole, ketoconazole, and econazole are effective for mild to moderate ringworm infections. These medications are available at pharmacies without a prescription, but it is advisable to consult a doctor. First, oral tablets for more extensive infections or in areas such as the scalp and nails. Your doctor may prescribe oral antifungal medications such as terbinafine, grisulfulfine, or itraconazole. This medication require a prescription and should be used as direct. That brings me to the end of my presentation. Thanks for listening. And inclusions of that is Ringworm may seem like a simple skin issue, but it can cause serious discomfort and even complications if left untreated. By understanding what causes it, how it spreads, what symptoms to look out for, and how to treat it, we can prevent the infections from worsening or spreading to others. Maintaining personal hygiene, avoiding sharing personal items, and seeking early treatment are key steps in managing ringworm. Education and awareness are the best tools to reduce infections in both in individuals and communities. That brings us to the end of the final sections. Now, if I can just summarize the main point again. First, what is ringworm? Second, ringworm symptoms. Third, causes of ringworm. Ringworm is a ringworm is a fungal infection that affects the skin, scalp, nails, and feet, caused by three main fungi: Trichophyton, Microsporum, and Epidermophyton, spread through direct contact with infected people, animals, or objects, and even soils. Common symptoms include a red, itchy, ring-shaped rashes, scaly skin, and sometimes blister or hair loss. Sometimes symptoms and appearance vary depending on the location of the infections, can be confused with scabies, eczema, or psoriasis, but has clear differences. Complications include carrion hyperpigmentation, cellulitis, and Majic granuloma if not treated properly. Treatment includes topical or oral antifungal medications depending on the severity and locations. That brings us to the end of my presentations. Finally, I'd like to end by thanking you all for coming today. And if anyone has any questions, I'll do my best to answer them. Thank you for watching.